guys, my name is Alexis and welcome to my channel. Today I'm going to be talking about my labor and delivery story. My last video ended on me talking about me and Ben getting our maternity pictures done. That was on Saturday the 18th, I believe, of April. On April 20th, I had been having high blood pressures. I was monitoring my high blood pressures for the past few weeks. Throughout the day, I was having high blood pressures, so I decided to give my doctor a call because that's what she had told me to do. I gave her a call, I gave her my numbers, and she told me to come in. She just didn't feel comfortable with me having high blood pressures and wanted to make sure everything looked okay. Once I went to the ER, I got checked into labor and delivery. They did check my urine, and it looked like I did have some protein in my urine. It did look like my preeclampsia was starting to get a little worse. It wasn't too concerning right yet. She still didn't want me to get induced quite yet. I told her I had an OB appointment on April 22nd. What she wanted me to do was to do a 24-hour urine sample. So she gave me 2 big jugs and she said 24 hours before your appointment, I want you to collect your urine and you're gonna take it into your appointment. And they're going to test that and see what your urine looks like over a 24-hour period and then determine if you need to be induced. I said, okay. So on the 22nd, I had my appointment with my periodontologist and she had already been in contact with the labor and delivery doctor that I had seen on Monday the 20th. She did say that she read the notes. On the 22nd, it did look like I did have protein in my urine. It was a little bit more than what I had on Monday, but still not enough to her want me to be induced right now. She said, let's go ahead and test your urine, the 24-hour urine sample, and I'm gonna give you a call back in a few hours. It should take the lab no longer than 4 hours. We'll give you a call back. We'll let you know what happens. If for any reason we do see anything concerning, we will ask you to come in tonight and you'll be getting induced. We'll be having this baby soon. I was so excited, but at the same time so nervous. Just because I was ready to have this baby. I was ready to have her. I was just so nervous just because I think I have another few weeks and they're like, nope, it's probably gonna happen today. I think as much as you want to have the baby, it's still nerve-wracking knowing, oh my God, it's finally happening. You could say you want it to happen, but once it's actually happening, it becomes very scary very fast. So after the appointment, me and Ben went home. He was waiting for me in the car. We went home and I had already started to pack up my to-go bag. So I just finished packing everything up. I made sure everything was in there. My mom had bought me everything for my to-go bag that I needed, so I didn't have to go to the store for any of that. So that was all ready to go. It was about like 6:30 when I got the call from the doctor saying it looks like there's a good amount of protein in the urine and they just don't want to wait any longer. She said, come in, we're gonna go ahead and induce you tonight. And I was like, okay, so this is it. So going into the labor and delivery, I was expecting, you know, before everything with the virus happened, my plan was to have my mom there and to have Ben there. And once, you know, Camila was born, I wanted my dad to go and my brother and sister to be there and everyone to meet Camila. I wanted Ben's parents to meet Camila, Ben's brother to meet her. And because there was so many restrictions, I was only able to have one person with me. That one person was able to stay with me, but once they came, they weren't allowed to leave. So once Ben came with me to be induced, he wasn't able to go anymore. He also had to pack a to-go bag. We packed food, we packed snacks, any kind of entertainment, extra chargers, all that kind of stuff. So I call my mom and tell her, all right, Mom, they told me I'm getting induced tonight. It was very sad for me just because I was expecting to have my mom there. It just made me very sad. I mean, of course, we're gonna be FaceTiming and talking, and it's just not the same. I wanted to have the support of my mom. I mean, even before I knew I was pregnant, I always knew I wanted to have my mom there with me. Whenever I was gonna be in labor, I always thought I'd have my mom there. But it was okay. Ben was there. You know, we had to just make the best of it. I didn't have a choice. I couldn't just focus on my mom not being there. So once we got there, I took some time to like check in and fill out a bunch of paperwork. I had pre-registered, but they still ask you to sign a million things and, you know, hook you up to all these IVs and just a bunch of check-in stuff. So I got to the doctor's about 7:30 in the evening, and to induce me, what they did was they started me on a medicine called Cytotec, and they gave that to to me vaginally. The nurse would stick a cytotec, it was like a little pill, vaginally about every 4 hours, and it was just to soften the cervix and to encourage contractions. So I said, okay. So that was what we started with. I didn't really feel any pain with it. The first 4 hours, I didn't feel anything. I was just hanging out. The second one, I still didn't feel anything. I didn't feel anything until maybe like the third or fourth one. And these are all 4 hours apart. It felt like just like normal cramping that you get, like a really bad like tummy ache. So it still wasn't really bad yet. It was a very slow progression. Right before they would put another cytotec in, they would check to see if I was getting dilated at all. And when I first went in, I was not dilated at all. So I was starting from 0. And I think by like the third or fourth cytotec, I was maybe at 1 centimeter. So it was a little discouraging, but I mean, there's nothing I could do about it, so we just have to keep trying. I was about the 4th cytotec there. By about the 5th or 6th cytotec, it had been 24 hours technically that I had been in labor and delivery, and I still wasn't in too much pain. I think by hour 24, I was having some like cramping that was like uncomfortable, but nothing that was too painful still. I would have times where I'd be like hold my breath a little bit and just like wait for the pain to go away, like a contraction, and then it'd go away and then it'd be fine. I'd keep talking. The long first 24 hours, I mean, I was really just being what I could. Me and Ben were just hanging out, talking. I was talking to my parents. I was FaceTiming, watching TV on my phone. I mean, I was really just anxious about having this baby. I was really anxious about like the pain that is to come. I cannot tolerate pain at all, so I was really nervous about that. I knew it was gonna be really bad. At about 24 hours, I was 1 to 2 centimeters. At that point, they did start me on Pitocin, and they said that would speed things up a lot. They did say they were gonna either do a Foley balloon or Pitocin. They went back and forth a little bit, and they ended up just starting me on Pitocin. Once they started me on Pitocin, I felt the contractions right away. They were very, very painful, and I started crying. It hurt really bad. I knew right away I didn't want to get any pain medication through my IV. It was just not something I wanted to do. I knew I was gonna get an epidural, but I wanted to wait as long as I could, just because once I had the epidural, I wouldn't be able to eat, I wouldn't be able to move around as much. But very quickly after getting the Pitocin, I knew I wouldn't be able to stand the pain for very much longer. So I think about maybe 30 minutes after I had Pitocin, I told the nurse, like, I'm ready for the epidural. The nurse said it would take maybe like 15 minutes for the anesthesiologist to come in and put that in. And he came in, and he was awesome. Everyone has always told me how awful I was getting an epidural, and so I was more scared for the epidural than I was to give birth, and I'm so happy I did get the epidural because it was not as bad as everyone makes it seem. I rather get the epidural 100 times more than having to go through labor without it. I was very happy to get it. Once I got it, for me at least, the pain went away in like a minute or two. It was great. It was wonderful. It was 8:30, maybe 9 once I got the epidural. So after that, you know, they told me get some rest because you will be having a baby soon. That's gonna take a lot out of you. Get some rest while you can. And the epidural should let you sleep. I said awesome. So the only thing with the epidural is they had to keep moving you to do your different sides. So every few hours the nurse would come in and have me move to like my right, to my left, back and forth, but that was fine. I was able to like fall right back asleep once they were done moving me, so that was fine. So now it is 7 a.m. on April 24th. A new nurse comes in and she's just introducing herself to me. She says, I'm gonna go ahead and check you, see how far along you are. I said, okay, that's fine. She does her thing and she's like, oh, you're only like 3 or 4 centimeters. And I was so bummed out just because I'm like, are you serious? You started this Pitocin, I've only dilated just 1 or 2 more centimeters. So it was just discouraging. I was hoping I'd be a little bit further along. The nurse did massage my cervix to encourage my labor to progress. My water still hadn't broken. At this point, I was just ready for things to progress. I was getting a little anxious just waiting so long. So she was massaging my cervix for like a minute and then they left. And I think an hour later, she came in and she was just moving me around. And I'm like, I feel very uncomfortable. I feel like a lot of pressure. I'm feeling a lot of pain. And she's like, oh yeah, that's normal. The epidural takes away the pain, but not the pressure. You're gonna feel pressure. But I'm like, no, but I feel like a lot of pressure. It's starting to like hurt. She's like, I don't think it hurts. I think it's just pressure. And I was like, okay. But then I kept telling her like, no, something's wrong. So she had the anesthesiologist come back and he checked the epidural and he said it looks fine. And he gave me another medicine. I don't remember what it was called, but he gave me another medicine. It didn't help. He said I should be able to feel in about like 10 minutes. It didn't help. I still felt the baby was very low. I felt like I had never had a baby before, so I had no idea what having a baby was supposed to feel like, but I really felt like I needed to go to the bathroom, which doesn't make any sense because epidural, like you're not supposed to feel anything from your waist down. I couldn't move my legs, but for some reason I felt like I needed to go to the bathroom. Once I told the nurse that, I'm like, can you please just check me? I really feel like I need to go to the bathroom. I'm very uncomfortable. She goes, okay. At this point, it's maybe like 8:30. She checks and she goes, oh, yeah, you're getting ready to push. So from 7 to 8:30, I went from 3 to 4 centimeters to you're ready to push. I was very surprised just because I was like, what? Like, when did my water break? At 7, my water hadn't even broken. The bed wasn't like super wet or anything. So that was kind of weird. I guess it must have been like leaking or something the entire time. Ben had just woken up at this point. I mean, it was early in the morning. He was waking up every few hours with me to help me move, to get me anything I needed. So it was kind of funny because he was just waking up. And I was just like, Ben, we're having a baby right now. And so that was really funny. I think he was like half awake as a bunch of doctors and nurses were coming in and starting to set up. That was really funny. So once the nurse said I was getting ready to push, she said, okay, I'll start calling everyone we need to call. So because of everything going on with Camila, we were going to have an entire NICU team there. So we were going to have a neonatologist there, a nurse practitioner there, 2 NICU nurses, a respiratory therapist, and that was all going to be just for Camila. And then I was going to have a nurse for me, and then my doctor, and then Ben. And they had a bunch of machines in the room. So one thing they did let me know was because we didn't know how well she was going to be able to breathe on her own right away. So they just had a lot of machines ready for her. We had, oxygen and things to help her out. Again, I was expecting for me to have her and for her to get taken away. So once, the nurse is calling the doctors, the NICU team, everyone to come in and get ready and set up. Because of COVID, everyone had to be in full PPE. So I'm talking masks, face shields, like heavy duty gown, crazy like thick gloves. It was very hard to hear them telling me to do anything because they were wearing so much. They had warned me about this before, that this was going to happen due to COVID. So I said, okay. I started pushing at about 8:45-ish, and by 9:20, Camila was here. I was really happy that I was able to have my mom FaceTiming. So she was facing my face so she can see me, talk to me, and say encouraging things to me. And then I was having Ben on my side and the nurse on the other side. So it was nice. I was still able to kind of sort of have my mom there. So at 9:20, Camila was born. She was born weighing 6 pounds, 11 ounces, and 19 centimeters long. Once she came out, I didn't hear a cry, and I, for 2 seconds, had a moment of panic, and I why isn't she crying? Just because with everything going on, my heart just fell, and right away, it must have only been 3 seconds, but it just felt very long. She started crying, and I was so happy, and she started to pink up, and she seemed to be breathing well on her own. I was so happy that when she seemed to be doing so good, they placed her on my chest, and I was so excited just because I didn't know if I was able to hold her as soon as she was born or not. So I was really happy to be able to go to hold her right away. I was holding her on my chest, and they were wiping her down, and everyone was kind of keeping a close eye on her to make sure she looked okay. She was doing really good. I really only had her for, it felt like a minute or two. But I was so thankful to have that just because I had gone through most of my pregnancy thinking I wasn't going to be able to hold her at all after I gave birth. So it was really nice to be able to hold her and have that time with her. Once, of course, they take her off of my chest. In the room, the NICU team assessed her, was checking her oxygen levels, and they were doing their thing. And they said she's actually looking really, really good. I'm like, okay, that's awesome. So they wrapped her up, they swaddled her, and they said, you could hold her for a few minutes, but we do need to take her away soon. I was so grateful to have her for just a few more minutes. They gave her to me, and I was able to hold her for a few minutes, and Ben was able to hold her, and we were able to take a picture, and I'll go ahead and insert that picture here now. And we were able to hold her, and I remember my mom was still on FaceTime at this time, and I was just hearing my mom, and my mom was just asking Ben, like, Ben, how do you feel? And Ben was just, he was still just in shock too. We were just so like in awe of this moment. And he was just like, it feels like a dream. And I think that's the best way to describe it, is like it felt like a dream. All of it, like being able to hold her, being able to finally see her, it felt like a dream. At this point, they take her, of course, the nurse, the NICU nurse, and the neonatologist, they have to take her to the NICU. Then she needs to be further evaluated. And I knew this was coming, and it was really hard because, you don't want to be taken away from a baby as soon as you had her, as soon as you just gave birth. But I knew it was coming, so I was able to spend a few minutes with her, maybe like 5 minutes, and then they took her away. But Ben went with her. We had discussed this before. I told Ben, like, you go with her. I don't want you to leave her side. You're gonna go with Camila, and I'm gonna be FaceTiming my mom. It's okay. I just didn't want Camila to be by herself. Since I couldn't be there, I wanted Ben to be there. He was gonna go with her to the NICU while she got taken care of. So I was talking to my mom. At that time, once Camila, had gone to the NICU, everything started settling down already. I had already delivered the placenta. Because I was so focused on Camila and holding Camila and having that time with her, I didn't realize I started getting lightheaded. I didn't realize the nurses were a little bit frantic, and so was the doctor, and I hadn't really paid attention because I was just paying attention to the baby. My legs were still up, and they were still massaging my tummy and getting all the blood out of me. And they were measuring how much blood I was losing. Now, that's normal to measure how much blood. They're just making sure you're not losing too much. I was FaceTiming my mom at this time. Nurses were going in and out of the room. They were cleaning up. They were measuring the blood. They were doing their thing. I was talking to my mom and just telling her I didn't have Camila. I started to feel kind of sick, but I was still talking to my mom. She did start saying, you're looking a little bit pale. You should make sure you should call the nurse. And I'm like, okay, I'm gonna call the nurse. And then I hung up the phone with my mom, and right away the nurse comes in and I'm throwing up. She grabs a bucket for me and I'm just throwing up in it. And I don't feel good. I'm pale, I'm lightheaded. She's going in and out of the room. All I really remember is at one point they're telling me, you're losing too much blood. I'm like, oh great, something else is happening. Gave me medicine orally to take. They gave me a few pills. They said we need to try to stop it, or we're gonna have to give you some blood transfusions because you're just losing too much. I said okay, so they gave me pills. Those didn't stay down. I was throwing up too much. Blood was still continuing to come out. Another nurse runs in, and she, as fast as she could, she brings in this huge needle, and she tells me, we need to inject you with this medication to help you stop the bleeding. You're not gonna feel it because you still have the effects of the epidural. And just stabs my leg and pushes on the syringe and gives me the injection. I'm like, okay. I didn't really have time to say anything, and I guess that helped the bleeding stop, which was great. But they had to be monitored extra closely, and they were still measuring the blood. That did stop the bleeding, which is awesome. So they did have blood coming just in case, but I never ended up needing the infusion. But they did say I did start to hemorrhage, but they were able to stop it before it got out of hand. So that was really good. The only thing with all the medication they were giving me is that it was going to give me the runs. So I just had a baby. I couldn't feel my waist down because I had an epidural, and I was about to have to go to the bathroom soon. So that was not fun. Right after I gave birth to Camila, they did stop the epidural. So soon after, I would say maybe an hour and a half after I gave birth, I needed to go to the bathroom. The nurse said you might still not be able to feel your legs. you might still not be able to walk on your own, like I could help you. I was really anxious to go and see Camila just because I wanted to know what was going on. I was getting texts from Ben. He was sending me pictures and just letting me know what was going on, that she was looking good and everything was okay. But I still just wanted to see her. So I thought, as soon as I wanted to do everything as fast as I could so I can go to the NICU. So I'm like, no, I could walk up by myself. And an hour and a half later, after I gave birth, I was walking by myself. I had to use the restroom quite a few times because of all the medicine that they had to give me to stop the bleeding. So that wasn't fun, but it was okay. They took me to postpartum. Once I was in postpartum, Ben came back and met me there because they were putting in the IV catheter in Camila's umbilical cord, and he wasn't able to be in the room with her when they were doing that. So they kicked him out, so he met me in postpartum at that time. Once we were in postpartum, I just wanted to see Camila, so right away because I was already able to walk and basically be fine without a nurse helping me, I showered, I ate, I did my hair as fast as I could, and I went to go see Camila. So I am gonna go ahead and stop this video here. My next video, I'll go ahead and talk about what happened in the NICU and our NICU experience and how that was a little different than expected. So I hope to see you guys next week. Please like and subscribe and comment on the video, and I'll see you next week. Bye guys.